Well, my name
And remember that we have an app and we also have a website. The purpose of the app and the website to watch or well to follow along with our programs even outside. I was we're not
after.
the world.
Mhm.
Okay. Yeah. So you can log on to our website, www.splashfm1067.com, and get to listen live from there. Or better still, download our app from your phone app stores, and get to watch and listen. All right, then, let's get on with our issue of the day. This morning, one statistic that has been much touted is the supposed World Health Organization recommended physician to patient ratio of one doctor to 600 patients. This is because, as with most professions, particularly ones such as medicine, adequate manpower will guarantee better service and be mutually beneficial to both the service provider and the recipient, that is, the doctor and the patient in this case.
Despite criticism of personnel shortage in the health sector by its various stakeholders, the Nigerian government has always doubled down on its insistence that the numbers are exaggerated and there are enough doctors in the country to treat patients. Most recent was Minister of Health, Dr. Sage Anire, who was quoted last month as saying that Nigeria has a sufficient number of medical doctors and that the number of doctors produced annually exceeds the number leaving the country.
Before we get to the refutation of his claims, let us look at figures on emigration of Nigerian doctors. The Nigerian Medical Association said in April this year that Royal Medical Council of the United Kingdom showed that the total number of Nigeria trained doctors who migrated the number of Nigerian doctors who passed the examinations and practice has grown exponentially since 2015 from 230 doctors then to 1,107 in 2022. Nigeria has the third highest number of foreign doctors working in the UK after India and Pakistan.
Nigerian resident doctors said 6 out of 10 doctors in the country plan to leave the country for greener pastures. Closed by the NARD president, 197 resident doctors in both the federal and state tertiary health institution as at December 2021. NNA President Dr. Uche Ojima made it known that there are only 20,000 and 25,000 doctors in Nigeria to take care of a population of over 200 million people.
This morning, we will spotlight the exodus of doctors in Nigeria amid the doctor patient ratio and what this spells for healthcare in the country. And joining us is
middle ground from have been done by different work groups within WHO to say, okay, what is the acceptable minimum that you could have? And that is how we picked on that 600. Whereas there are countries that have one doctor to 300, one doctor to 200, which is still a far cry from what we are saying, okay, let us at least get to this point first before we start looking at other things. Of course, that will also mean that as we work towards this, we would also want to work towards reducing the burden, on the health sector by ensuring that people actually learn to live, life well, such that they are able to avoid both communicable and non-communicable diseases. But unfortunately, you also then realize that the means to live this good life, so to say, healthy life, is not readily available to the people. So you have a vicious cycle. People living in slums, people living in environments where they generate wastes, and both, of course, biological waste, as in urine, defecation, and all of that, and the waste generated from the normal daily life of it, you use a material, you dump,
Nylons,
and all
plastic.
that, and all of those stuff. Those areas too are not taken care of. So you have the increasing burden of having foodborne and waterborne diseases also there. Also, again, you also realize that the availability of potable water is still a scarce thing. It's still something that people still dream of in this day and age. And so because you don't have potable water, people drink whatever is available, in some settings. You're lucky. As you travel through Nigeria, you see where people scoop water to drink. And you marvel that people will drink water from streams. If you are downstream, you are drinking water contaminated by the excrement and all those things, urine of animals and man upstream, as before you get downstream. So we are still not there yet in terms of providing those things that would make the burden of health, to reduce. And of course, nutrition is also one thing that you need to ensure, especially in the under 5 and school children generally, is still a dream in some places. So it's a vicious cycle. The causes of the burden on health continues to increase, and means down. That does not help anybody.
I think you even mean that not just appeal, denial. There's flat out denial that it exists.
You see, the denial is one thing I don't want to mention. Honestly, as a the denial, and it actually paints us as a country as if in the eyes of that persons or those persons we are fools, because how can you deny what is obvious? I put my hands in front of me, I see 5 fingers, and somebody is telling me there are 2. That is annoying. Okay, and it's not as if I'm visually impaired. Even if I'm visually impaired, I can count my own fingers, without seeing them. And that is the most annoying. I just don't like, remembering somebody said those things.
So, really, we've talked about the ideal and some of the drivers of the system. So, you're a practitioner as well as the chairman of the NMA now. Bad, really. Things become.
Well, there are 2 ways to look at, or possibly 3 ways to look at the sector. You look at the input, you look at the process, and you look at the output. Okay? At the input end, that is outside of those pressures that I have mentioned. If you look at those pressures as goals that you need to, surmount, or the goals you need to achieve is to eradicate or reduce to the barest minimum those pressures. So we'll leave that out. what's the input? The input into the health sector is will require first, beyond policies and programs, how do you source your human resources? You source your human resources amongst, of course, children in secondary school who want to be doctors, who want to be nurses, who want to be laboratory scientists, and all of that. And right now, a certain child somewhere, haven't so well sat for WAEC, got all the papers, and then sat for JAMB, and then scored so high enough to be able to admitted to medical school. And he started the first semester. He's happy. He's on his way to achieving his dream. He's been sitting down at home now for more than 6 months. He's been sitting down at home now for more than 6 months. And while he's at home in these 6 months, he's listening to me. He has read in the papers. He had seen on TV. While walking down the street, he has seen in the health center or the hospital nearest to him that what he is dreaming about looks like a mirage. And in a rethink, now he has made up his mind. He's not going back to medical school. He started doing some IT courses or something somewhere, and he's not going back. Okay? He's heard that because these nurses, these health workers are not well treated. He had a dream. But dreams are different from food, and so right now. And one another chap on the same street, he has done, he may not get into school, and he can see that Kabiru or man that went to learn a trade is already something will start in his head. Let's say eventually you now become, he now pulls through his medical school, the rigors and everything. He's here now, he's a doctor. And in trying to get a place to even do his housemanship, he had to traverse the whole of this country to look for a place where he'll be accepted. In a country where you say there are no doctors, the system is warped. So he decided to take it up centrally so that he can placement. No, this center, the portal is opening. And he's based in Lagos. He said that lives are not safe in some countries, not. So he's not ready to portal those centers to pick, to, enter into the pool to be selected. So he's looking at somewhere safe. Not coming. And so you see, eventually he gets into the profession. He has spent like 10 years, 11 years. And then he looks around. He sees Biodun who did a 4-year course in a private university. Or he sees somebody else who took up apprentice somewhere and they're already having a family. Their parents are already happy about it. And he's still there, almost 30, back home to ask for money. So finally he gets a job to take care of himself. Much more, his aged mother. Just take it that 30. If his mother gave birth to him at 2, he's already 55, approaching retirement. Or let's say he is the last born now, and the parents are already 70. Still can't go home to say that this is from my salary. Not dead yet. Where he is working, what tools does he need to work with? Are they available? Is he comfortable with the results that he is getting? Or is he comfortable that somebody came yesterday that he lost, the person lost a relative who had been sick at home and they've been going to church, mosque, chemist shop, herbalist. One is about to die in the hospital and the person died. And because the person died in the hospital, somebody within the family is head turned and it carried a stick and started pursuing doctors and nurses all about, or hit somebody on the head, locked up somebody, injured somebody, and all of that. Is he comfortable that that's the life that he wants to live? So already there is a lot of things brewing. And so the next point, Japa. That's the slang in town now. And so he's there to move. So the input has a problem. The process that goes along making that individual, whether a doctor or a nurse, what they are today is also warped. And so what do you expect of the outcome? The bad side of it is that if a hospital started now with 10 doctors and there is still a problem with that number, 2 months, 8 are going to be doing the work of 10. And then 6 leaves, and I mean, at some point, 6 is left, 4 is left. And those 4 too are thinking, this hospital is not taking people to replace the ones that have left because of central government in the state or the federal to be able to get approval to replace those people that are left. So 4 job that 20 people were supposed to do and 10 people were doing that. Those 2 will find their way out. So it's getting worse by the day. Just like I was talking about the burden of disease, the pressures, increasing, and the wherewithal to solve them is also decreasing.
Break. We'll continue, pick up with this line of thoughts that you started on after this commercial break. Don't forget to send in your comments on social media. We'll be right back. This is Panorama on Splash 106.7 FM.
We educate. That's why we are respected. That's why we are loved. More music. We are the best. The Integrity Station. Splash.
106.7.
Ǹjẹ́ ẹ ti gbọ́ wípé ayẹyẹ ọdún kẹta iléeṣẹ́ Frabjous Family Estate and Investments Limited ti gbọ̀nà àrà yọ sílùú Dubai báyìí. Dubai yóò gbàlejò corporate landlord pàtàkì láwùjọ láti pẹ̀lú báwa rìnrìn àjò yìí. O ní láti ra plọ́ọ̀tì ilẹ̀ kan ní Adorable Hilltop ní àdójúkọ Golf Club Mamutown Òkèmọ̀sán Abẹ́òkúta pẹ̀lú 6 million naira. Àwọn lọ́balọ́ba níjòyè àwọn lọ́lá gbogbo ibẹ̀ gangan ni wọ́n ti ń ra ilẹ̀ tí wọ́n sì ń rà sí báyìí. Wọ́n ti rí wípé iṣẹ́ ilẹ̀ ìjọba tí kò sì ní wàhálà ọmọ onílẹ̀ kankan. Tó o bá ti san 6 million naira, wàá gba ilẹ̀ rẹ lẹ́sẹ̀kẹsẹ̀. Bákan náà ló tún ti lẹ́tọ̀ọ́ àti àǹfààní láti bá wa rìnrìn àjò lọ sí Dubai. Ṣẹ́ra fún yóò. Ilé iṣẹ́ Abnim Travels and Tours láti mọ̀ gẹ́ni mo wo níbi kábániṣètò ìrìn àjò sókè nírọ̀. Tètè máa bọ̀ lọ́fíìsì wa pẹ̀lú international passport rẹ ní Jídé Jones Way beside Ayira Kitchen Òkèléwé Abẹ́òkúta. Hello Dubai 0702 5000 0702 5000.
Lójijì bóun gbogbo tilẹ̀ ti lásìkò yìí ìyẹn ò wá ní kọ́mọ tuntun jòjò kan tuntun ní the Honest Global Covenant Baby Care ṣe sílẹ̀ ẹ̀kọ́ àǹfààní yìí sílẹ̀ fún gbogbo ìyálọ́mọ pátá. Wọ́n máa sanwó ẹrù ọmọ wọn díẹ̀díẹ̀ sọ́dọ̀ wa títí dàsìkò ó sì jẹ́ pé ṣe lè fẹ́ ra tìyín lẹ́ẹ̀kan náà. Déédéé ló ṣe. Kò wá sírú ẹrù ọmọ ìgbàlódé tó jẹ́ ojúlówó tẹ́ fẹ́. Tí ò sí nídìí ẹni. Gbogbo ẹ̀ pátá lówó tí ò ga jara lọ. Bá a ti ń ta àwọn ẹrù ọmọ àti tìyálọ́mọ náà la tún ta àwọn aṣọ ìgbàlódé tó jẹ́ ojúlówó tó buyì kúni láwùjọ. Fún tọmọdé tàgbà office and casual wear. Fún tọkùnrin tóbìnrin singlet boxers shoes and bags.
to study literature and speak like Chimamanda Adichie, she should be happy doing it. Even because for health sciences in all federal universities, we are higher regular ones. Now, but because we come to Nigeria where left up is down and down is up, these things are issues. Security of a nation goes beyond health.
Right.
If we are all healthy and our farmers are kidnapped, our environmentalists are not happy, our engineers in the health sector
the 555, the appeal factor to doctors.
To the health sector. And I know that when the health sector becomes...
Can we do? Then we separate into